This is a Modern Man podcast. I'm your host, JD Farrell, and I'm so excited. On this episode, we're joined by my uncle, Dr. Peter Brent Stanbro. He's one of the leading physicians treating PANDAS patients in child and adolescent psychiatry in the state of Oklahoma. And I'm so excited for you to hear about his story from the start of the pandemic until now, how they didn't have any shutdown and was still able to treat over 10,000 patients and still employ 20 people. Good friend, my uncle, Dr. Peter Stanbro. How are you doing today? Good. Yeah. Awesome. So I want to start by giving the audience a little bit about your background and kind of your specialty and what brought you to where you are today.
Okay, so I studied psychiatry. Well, I went to med school in New York State, and then psychiatry at Boston University, and then I did a subspecialty in child adolescent psychiatry at University of Massachusetts in Worcester, and then I stayed living in Massachusetts for about 10 years and was practicing up there, and due to a family health issue, I moved to Oklahoma to take care of a parent. So I moved home. I was teaching faculty at University of Oklahoma School of Medicine for a few years, and then opened a private practice, and I still teach at the med school. I have medical students who rotate through here in their psychiatry rotation, and it's a busy practice. We now have 8 providers and about 20 employees, so it's really busy, and my passion is helping kids, and we've seen an uptick in a lot of issues with kids and parents and everybody during COVID. It's been remarkable to see what we've seen.
Okay. And so I want you to rewind back to about March 2020 when COVID first struck back. And you have about 20 total employees, about 12 administrative employees and 8 providers. And about how many patients you think the practice sees as well?
On our roster we have we have over 10,000 total active. I would say near that. Some are considered somewhat inactive, and they sort of come in and out, so might need to kind of bounce back if issues come up. So they're not seen on a monthly basis or even an annual basis, but we tend to see people who might need to come back and see us after a few years. So we'll see that.
Okay, so that would leave about 10,000 patients without medical care and 20 employees without jobs if your practice wasn't able to run during the pandemic.
Correct.
Yeah. And what steps did you and the practice manager, what steps did y'all take to continue to see patients when
Let me just back up and make one clarification. In March of 2020, that was the count.
Okay.
We've grown.
Okay.
Since then. So I would say probably now we are maybe more towards 15,000 total patients. We've added providers. We have added 2 providers during the pandemic just to keep up with the volume.
Wow.
So, what steps did we take? Well, in the beginning it was, we had no idea what we were doing. We didn't know. I had colleagues like pediatricians and other specialties who, out of fear, out of risk, out of not knowing what to do, and advice from others, medical community, to close their doors for a period of time. At the time, we were not doing any telemedicine, and because some of the bigger insurance companies were not paying for telemedicine, and that's the reason why we had not offered that even pre-COVID. And so we very quickly kind of figured out we needed to protect ourselves, we needed to protect the population coming in, and because we would have, I don't know, at any given hour of a day we might have 30 families coming in and out of here with a couple of generations of people, caretakers. A lot of grandparents take care of their grandchildren these days, and blended families. So a lot of people who might be at higher risk because of COVID. So we had to move quickly. We closed our doors. We secured the insurance companies that would pay for telemedicine, and we petitioned those that were initially saying no. We reached out to them, to the state. We tried to get some guidance from the Oklahoma Board of Medicine and the Insurance Commission, and we're just on it as far as like trying to get what we could for to be able to continue seeing patients and to be paid for it. So we did what we could as quickly as possible. I would say for as little as we knew to start, it was a rather smooth transition. We didn't do any telemedicine one day, and the next day we were doing 100% telemedicine, and we made it work. We made it work.
And what do you think are some of the advantages of telemedicine versus seeing patients constantly, at least to keep it going in the future?
Yeah. Oh, the fact that it allows more people from farther distances to access healthcare. It has absolutely been a game changer, and I think that absolutely think it ought to continue. For people who do not have the means to get here to a physical location, we have people driving from far distances, hours away in the state to drive here. If they don't have the means to get here, they did not get health care, or they did not get child and adolescent or even adult psychiatry care if they didn't have any in their community. There are not that many, certainly not pediatric psychiatrists or adult psychiatrists for that matter, because we see all ages in their community. And so if you only have, just a handful of providers in this specialty, people would have to drive quite a distance to get here. We actually have people coming from 8 states to get the care that we provide pre-COVID. So that we can see these people and they can do this from the convenience of their home. It opens up so many more venues for people to be seen, and so many more people can access care. It's absolutely, I think it ought to continue. I think it would be criminal not to allow that to continue. If it doesn't, I think that we ought to be writing at all levels of government, and insurance companies ought to be mandated to allow this to continue. Absolutely.
And obviously you've been very receptive to it, but what's the feedback you receive from patients and maybe other providers about telemedicine? Has it been the same, or any negative feedback from it?
I would say I could count on 2 hands, my personal experience, the number of patients who feel like they have some existing patients of mine who feel like they would rather see me in person. And I get that, I understand that. Although I do think that when it's working well, that this is just as personable, because I know the patient, I've known a patient for a while. I think it's just as easy to communicate with them as it would be if they were sitting here. It does make it a little bit more challenging if it's a new patient, because there are things like body language, sometimes just the inflection in somebody's voice, the quality of the video on one end or the other might compromise a little bit of some of the most subtle things that you can pick up on somebody's a conversation or body language or something like that. If you're seeing only this much of somebody's body, you don't know if they're wringing their hands, tapping their feet, fidgeting. You know, there's just a whole lot you can get from observation that you might not get on screen. So there's some compromises, but at the same time, it is, otherwise you might not even be able to see this individual. They might not even access healthcare. So for that, I think it's worth the compromise.
Okay. And so what do you think are going to be some of the barriers from telehealth, telemedicine continuing forward?
There are indications that insurance companies are already looking to discontinue. So whenever towards the end of the year, as we were getting into November and December, and people were looking to, have to renew their insurance with their employers, and we would be talking about it because we were doing this here as well, because I offer coverage for my employees, and we were talking about, okay, for your healthcare provider, for the people that I employ here, when they're looking to make sure that their doctors, their primary care doctors, and their other healthcare professionals, are they offering telemedicine? Is the policy that we're offering my employees, is it going to cover telemedicine in the future? Is there a package that they can pick of what is available? Will that include that? And can we ensure that that is going to continue before those choices are made by my employees? And I was putting that out there when I would have conversations with the patients. As you're picking your healthcare policies for next year, ask your HR person, ask your employer, is it going to include telemedicine? If you want this, if you like this, if you want this to continue, as I'm talking to them on screen, ask, insist, demand, whatever it is, whatever verb you want to make sure that that continues. Because there's already indications that they're looking for ways to, as quickly as possible, discontinue it.
And why do you think that is?
Well, I got a flyer in the mail from my own insurer that was like, very shortly we're going to be making changes to, pre-COVID state of, business as usual. Be looking for these. And telemedicine was as one of those little bullet points that was in this. It was just a little simple flyer that they had printed out and mailed to me, and I'm looking at it going, yep, that's absolutely what they're looking to do, because it costs them more money if they have to pay for more people with their insurance, because those people are now able to get care from the privacy of their home. They're looking for ways to discontinue that as quickly as possible. No doubt in my mind.
Just another barrier for more people to get more adequate health care. But
yeah. It's cheaper if fewer people see a doc.
Wow. So, going forward, are you afraid of opening your doors to the hundreds of patients on a daily basis that are going to eventually be coming back into this office?
No, I think when the time is right, if it's not rushed, I've already gotten my first vaccine. I need my second one. I trust the science. I understand vaccines. I don't fear that. I want all of my employees to get vaccinated, but it's everyone has the choice. I hope that most people will not be afraid of the vaccine. In the general public, they will get it, and I want them to get it. I encourage. At some point we'll have that herd immunity when it's like 70+% of the population gets vaccinated. So when we're at that point, I don't fear it because I trust in the vaccine and how it's going to work.
Okay. Are there any other fears in the future of your specialty or in the field of medicine you're afraid of?
Any fears in the future?
Maybe changes to the infrastructure of.
Well, yeah. I don't know if this is, the appropriate forum or not, but because it is such there's such a shortage of providers in this field. There's talk of expanding providers to include what are considered mid-levels, which are physician assistants and nurse practitioners, which currently require a supervising physician to oversee their work. It's because a doctor, to get in this position of being able to do this work, takes 10+ years.
Wow.
To just do this.
Yeah.
And that's not counting any other extra work. I did some extra stuff.
Yeah.
So at least 10, where to do a nurse practitioner to be a prescriber, 2 years. A physician assistant, 2 years. Start to finish.
Yeah.
And so that's the reason they work under the supervision of a doctor. Now there's talk of having those people be completely independent.
That is astonishing.
That's my fear.
Yeah.
It's dangerous. I don't think they're qualified. I employ physician assistants here, and I have in the past employed nurse practitioners. And I think they're good at what they do when I'm supervising their work, and I can oversee it, and I can discuss, and I can say these are the things that I need you to do, and I can see it, and I can co-sign a note, and I'm guiding them, and this is the medicine I need them to take, this is the stuff I want you to do, and here's the way I want you to do it. That's the way it's supposed to work.
Yeah.
But for them to be solely independent and nobody else is doing overseeing the work, and it's with a 2-year base education, scares me.
And are the same people who are allowing these people to go and practice on their own the same people not allowing telemedicine to become more frequent? Because I don't know, why would they be letting those changes happen, but then they aren't letting more people access medical?
Well,
or these two different bodies?
There are several different bodies. There's a national organized nurse practitioner governing oversight body that represents them. They have a strong lobby,
Okay.
A strong voice, and they're pushing for that.
Okay.
There's a national body and a national body that promotes and lobbies for physician assistants. And they're pushing as well, not as hard, not yet, but nurse practitioners have been pushing for independence for years, and several states have granted that in those states. Not here where we live in Oklahoma. Quite frankly, insurance companies, you think about it, they can pay a physician assistant and a nurse practitioner less money, so sure, they're for it.
Okay. And I feel like in all this, it's really minimalizing the credentials of what a physician is then.
If somebody could go to school for 2 years and come out with little or no debt versus go to school for 10 or 12 years and come out with well into 6-figure debt and do the very same thing, why even have med schools?
The cost benefit, yeah.
Why even have med schools? What's the point? It's dangerous.
It really is.
So.
Okay. I guess we'll close it on this. Anyone, we know the pandemic took a toll on a lot of us, and a lot of people are trying to reach out there for some mental health, but those who are a little afraid and maybe afraid of being prescribed something, or any advice to that person who wants to reach out, or maybe a little afraid of what someone may think of them? Or
well, I mean, I think over the course of the last probably 10, maybe 15 years, there's been a decrease in the stigma of, seeking out help for mental health issues. I think it started with post-war soldiers seeking help with the VA system and things like that. You know, it was public dialogue when the VA was overwhelmed the VA system was overwhelmed and they couldn't manage all of the soldiers needing some mental health help. And I think it became a national dialogue, and I think it became less stigmatizing to at least address it. I think over time people are just more aware of things like PTSD or anxiety and depression. It's much more common than people realize. And talking to someone, it's across the world actually, but it's certainly across the nation. People are suffering, all ages. There's so much fatigue, and there's just so many things that are stressing people out. In 2020, from pandemic to race riots and to political unrest, and you know, now there's fears of can we get a vaccine appointment? Are we going to get a second one? Are we going to run out? Now we've got some super strains, and I mean, it just goes on and on and on. Are we going to lose our job? Are we going to get kicked out of our apartments? We don't, you know. Are we going to get our support checks? Are we going to, unemployment's going to run out? You know. So if there's anything I would say, it would be you're not alone. It is not stigmatizing to simply ask for help. It is private. It is secured. And just because you reach out for some help does not mean that you are going to be mandated a prescription or loaded up with a whole bunch of bottles of pills that will dumb you down or make you feel like a zombie.
Dr. Stanbro.
You're welcome.